Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. The Roundup for the combined months of December 2024 and January 2025 includes stories about the recent breakthrough discoveries on cancer research, graduate student award winners, and saying goodbye to a beloved nursing dean, and more. The College of Nursing held an emotional farewell celebration in honor of its outgoing dean, Dr. Neetha Dick, at Marshall McLuhan Hall on January 15th. Over 140 people attended the event, some traveling in from Saskatchewan and northern Manitoba. Radi Faculty of Health Sciences Dean Dr. Peter Nickerson hosted the celebration, which included tributes from President Dr. Michael Benarosh, Provost and Vice President Dr. Dan Hebert Murphy, and Nicole Harder, Associate Dean, Undergraduate Programs at the College of Nursing. Nickerson thanked Dick for her leadership over the years, including navigating the COVID-19 pandemic and the expanding of the Bachelor of Nursing program to address the province's nursing shortage.
Dr. Dick leaves behind a legacy of tireless commitment to her faculty, staff, and students, and she's always been there to support them and champion their successes along the way. Dr. Dick, I want to thank you for your vision, your integrity, your one-of-a-kind leadership, and congratulations on your distinguished career and all the best in your next chapter. I also want to say on a personal note, as I've been here the last 2 years, Neetha, it's been great to be able to work with you. You've brought a lot of experience to the table and a lot of wisdom to a lot of the discussions we've had, and you're going to be greatly missed over the next few years. So all the best.
Dick, a nursing alumna, was Dean of the College of Nursing for the last 7 years. Her term ended January 31st, 2025. At the event, she reflected on her 5-decade career and thanked the colleagues, mentors, and students who have inspired her.
As I look ahead, I am filled with optimism for the bright future of nursing and nursing education. The work we've done to address the shortage of registered nurses, nurse practitioners, and registered midwives, and to enhance the quality of education will undoubtedly continue to shape the future of healthcare for years to come. And no doubt you will continue to push the boundaries of innovation in nursing education and research. I have full confidence that the leadership of the College of Nursing is in excellent hands, and extend my best wishes to my esteemed successor, Dr. Kelly Thiessen. I'm excited to see the next chapter unfold and the new heights the college will reach with her leadership and guidance.
The 2024 Dean of the Radi Faculty of Health Sciences Graduate Student Achievement Prize was awarded to 10 extraordinary graduate students. The award recognizes outstanding academic achievement, strong leadership skills, and notable personal service. One of the prize winners is Toby Olanipakun, a master's student in physiology and pathophysiology at the Max Rady College of Medicine. He's studying a protective protein called thioredoxin to see if it can protect brain cells and potentially be used as a treatment for neurodegenerative conditions like Alzheimer's disease.
Yes, so the award, I believe, is going to be a push for me to keep on including myself in other things outside of research, because being like an all-round individual, while I am active in my research but also active in the community, also active in my academics also, so I think it helps me to further explore more rather than just being boxed up, but to explore more opportunities that are available to me and more ways to be actively contribute to the community.
Outside of the lab, Olanipakun is involved in several initiatives to improve diversity and inclusivity in science, including the Rady Faculty's Biomedical Youth Program. He's committed to the community because of his upbringing.
For my background in Nigeria, Africa, it's there's a saying that it takes a community to raise a child. So I grew up with receiving lots of inputs, parents, family, friends, and the like. So it's just like an act of responsibility to be able to give back.
Each Rady Faculty College could nominate one master's student and one doctoral student. Colleges without a doctoral program could nominate 2 master's students. When When a child has appendicitis, the standard treatment is to remove the appendix. But what if surgery could be avoided by giving the child intravenous antibiotics instead? Dr. Richard Kaiser, a surgeon at the Winnipeg Children's Hospital and professor of surgery at U of M, was part of a large international study comparing the two approaches. The researchers found that for about 1/3 of the kids who received antibiotics, the appendix flared up again within 1 year and they had to have surgery. But for the other 2/3, the antibiotics took care of the infection. Kaiser spoke with CTV Winnipeg about the study. He said doctors used to think the appendix served no purpose, but it's now believed to play roles in the immune system and gut health.
So if you can keep your appendix, then you could potentially benefit from it by holding on to it. And the other thing would be if you can prevent having surgery, which also is associated with small risk, then you're not exposed to those risks.
Most kids in Winnipeg still have an appendectomy, but Kaiser said the antibiotic option is available.
For parents and patients now there is an option to discuss. If you don't want to take the risk of surgery, then in some cases it's possible to treat it just with antibiotics.
11 researchers from the Rady Faculty of Health Sciences were awarded nearly $10 million in the latest round of Canadian Institutes of Health Research project funding. The scientists are examining a wide range of topics, from new drug combinations to treat blood cancer to determining how the communication between astrocytes and neurons occurs. One of the grant recipients is Dr. Jude Uzona, a professor of immunology at the Max Rady College of Medicine and Vice Dean Research at the Rady Faculty. He and his team received more than $1 million over 5 years to study what could one day lead to new treatments for a parasitic disease called leishmaniasis. The understudied disease spread by sandflies affects more than 12 million people worldwide. Uzona said it's starting to spread to non-endemic countries like Canada.
It is important for us to study it because it's coming. It's really coming because of global warming, because of increased immigration, because of our soldiers coming back from peacekeeping duties from other parts of the world. If we can understand and have a vaccine for it, then it becomes a magic bullet that we can use to prevent it. We don't have to worry about it.
Uzona's study aims to better understand the role of a molecule called pentraxin 3 in the disease. He says that targeting pentraxin 3 might be a good way to develop new treatments for leishmaniasis. It is that time of year again where we often see an uptick of people suffering from respiratory illnesses. This year there have been cases making international news, such as in China there has been a surge of HMPV cases, which mostly affect children, and in California a state of emergency was declared over the H5N1 or bird flu outbreak. Dr. Jared Ballard is a professor and pediatric infectious disease specialist at U of M, and he spoke with CBC's Up to Speed about this and what concerns Manitobans should have and how they can protect themselves.
HMPV, or human metapneumovirus, is actually one that's been around for quite a long time. It's over 2 decades at this point. And so certainly we know at the Children's Hospital in Manitoba, as well as across the country, we see infants in particular come in with human metapneumovirus, or HMPV. And it typically can make them pretty sick, but most of the time it's usually a pretty mild cold. H5N1 is what we call bird flu or avian influenza, in that it likes to stay mostly in birds, but every now and then we do see human cases as well. And so the good thing is that it's not really the best virus at going between humans so far, but it's important to ensure that we keep an eye on things. And I think that we do that really well working with Manitoba Health, the Public Health Agency of Canada, and the World Health Organization to watch all over the world to make sure that it's not doing that.
While some people may be feeling concerns spilling over from the recent COVID-19 pandemic, Bullard says it is best for people to just focus on what they have control over.
I think there's lots of things that people have complete control over. So first, people, if they're feeling unwell, can stay home so they don't spread it to their friends, neighbors, and colleagues. They can also make sure that when they're out and about, they're washing their hands and paying attention to what they touch. If they're sick and they cough, just making sure they're coughing into their elbow. And there's also a variety of vaccines which are really useful. So you can get your seasonal influenza shot every year. You can make sure, too, that kids in particular get their routine vaccinations, because what can happen after you have these respiratory viruses and an infection, you can get a secondary infection where ear infections or pneumonias can occur as well. And I'd also like to remind people that these viruses are a little bit different. When talking about human metapneumovirus, it's been around a long time, meaning that we've been exposed to it, we have lots of immunity to it, so it's not going to behave in the same way that COVID did during the pandemic.
A professor at U of M recently launched a podcast designed as a resource for graduate students, medical trainees, and residents to help them in their journey to their first scientific research project. The Emerging Scholar podcast features host Dr. Jonathan McGavick, a professor of pediatrics and child health at the Max Rady College of Medicine, speaking with a variety of expert guests in the health sciences research field. McGavick says each episode will take students through the different steps involved in getting research projects started through conception all the way up to completion.
I've got about 3 seasons in my head, planned. A typical resident trajectory would be 3 years. So year 1, you're just getting the project started, you're trying to find access to data, you're coming up with an idea. So we've kind of mapped that out. Things to think about in those early years would be like introducing the concept of race or racism, right? If you're thinking about that. So there's some elements that you would want to touch on in all 3 years, but we're trying to introduce some of those in. In your second year, you want to pick a method that you're going to use to answer your question. So we're going to go through a deep dive on the standard methods that you were taught in your undergrad or in medical school that you know a little bit about, but we'll do a deep dive. And then we'll give you examples of if you're interested in this method, here's some data you could actually get access to, right? Here's an amazing resource for you if you want to do that. And then towards the end, we're thinking how to write well. That's the biggest challenge. How to communicate your science. How to go back and forth with your statistician when you're analyzing the data. So at the end of the third year, you'll have all the resources you need to complete the project. And then we also want to introduce some inspiring, we have this idea of pediatricians I mostly admire, where we interview, either senior investigators that have had an illustrious career, and they're going to inspire you about how they started as a resident and where they are now, but also some new investigators that have plunged into this for the first time, and they're working as clinicians, but they're also doing research at the same time to give people advice about how to balance those two things and why it's important for them to do research. So throughout that, we'll kind of intersperse some of these motivating interviews with experts in the field.
The podcast was produced with UMFM station manager Jared McKetiak, and the first episode was released early January. Episodes can be found on all streaming platforms along with the UMFM website. Dr. Sabine Mai, UM Canada Research Chair in Genomic Instability and Nuclear Architecture in Cancer, recently published co-authored findings in the American Journal of Hematology. The groundbreaking study showed that a method developed by Mai and her team can accurately predict the risk that a patient will progress to having multiple myeloma, an incurable blood cancer. Mai uses three-dimensional imaging and microscopy to visualize genetic material inside a patient's cell to reveal genomic changes and instability. By marking the ends of chromosomes called telomeres, 3D measurement tools the team developed indicate whether the cell is stable or cancerous well before clear symptoms are present. Mai explains the process in a recent video produced by U of M.
Some people call the research groundbreaking because this is the first time that based on the nuclear architecture of a cancer cell, we are able to stratify patients to determine what's their risk to progression, to propose treatment options that are there to prolong progression-free and overall survival for the patients with smoldering myeloma. This can also be applied to other cancers. We have studied 14 different cancer types, and in each one, we were able to risk stratify and to monitor treatment success. This type of research puts the University of Manitoba at the center of innovation in cancer research.
Thanks for joining us today. What did you think? Send us your ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.